Cervical cancer is a serious health issue. It affects many women around the world. This cancer grows in the cervix. The cervix is the lower part of the uterus or womb. It connects the uterus to the vagina. Knowing about cervical cancer is very important. Early detection can truly save lives. This is why we must raise awareness now. So what exactly is cervical cancer? It begins when cells on the cervix change. These cells start to grow out of control. This abnormal growth can form a tumor. The main cause is a persistent infection. This infection is from certain types of HPV. HPV stands for human papillomavirus. It is a very common virus, but some types are high risk. All women who have a cervix are at risk. This means most women can get cervical cancer. The biggest risk factor is long-lasting HPV infection. Smoking tobacco also increases your risk. Having a weakened immune system is another factor. This could be from HIV or other conditions. Not getting regular screening tests is a major risk. It's important to know these risk factors. Why is awareness so incredibly crucial for us? When you understand cervical cancer, you gain power. You can take steps to protect your health. Finding cervical cancer early makes treatment much easier. It also means treatment is more likely to succeed. Knowledge helps you make informed decisions. It allows you to talk to your doctor. Please share this vital information with others. Screening tests are vital for your health. They help find cervical cancer early. Sometimes they find changes before cancer develops. These are called precancerous changes. Treating precancerous cells can prevent cancer. Screening is a powerful tool for prevention. It is one of the best ways to stay healthy. Regular checks are truly your best defense. There are two main types of screening tests. The first is the Pap test, or Pap smear. This test looks for abnormal cells. It checks for changes on the cervix. These changes could become cancer if not treated. The PAP test has saved many lives. It has been used for many decades. It's a well-established and effective screening method. The second test is the HPV test. This test looks for the human papillomavirus itself. Specifically, it detects high-risk HPV types. These are the types known to cause cervical cancer. The HPV test can be done by itself. It can also be done at the same time as a Pap test. This combination is called co-testing. Your doctor will advise which test is best for you. Regular screening is extremely important. It is the best way to detect cervical cancer early. When found early, treatment is often simpler. The chances of a full recovery are much higher. Do not wait for symptoms to appear. Early cervical cancer often has no symptoms. Screening finds problems before you feel them. Make screening a regular part of your healthcare. Screening guidelines help you know when to get tested. For women aged 21 to 29, a PAP test is often advised. This is usually recommended every 3 years. For women aged 30 to 65, options expand. You might have a PAP test every 3 years, or an HPV test alone every 5 years. Another option is co-testing every 5 years. Always discuss your specific needs with your doctor. What happens during a screening test? It is usually done in a doctor's office. You will lie down on an examination table. The doctor or nurse will be very gentle. They use a small instrument called a speculum. This helps them see your cervix clearly. Then, a soft brush collects a few cells. The process is quick, lasting only a few minutes. Let's talk more about HPV. HPV is a very common group of viruses. Most sexually active people get HPV at some point. Often your body's immune system clears the virus. It might go away on its own without issues, but sometimes high-risk HPV infections persist. These long-term infections can cause cell changes. Over many years, these changes can lead to cancer. After your test, you will get your results. Your doctor's office will contact you. This might be by phone call or a letter. Normal results mean no abnormal cells were found. This is good news for your health. Abnormal results do not always mean cancer. It might mean you need more tests. Your doctor will explain everything clearly. Many women face barriers to getting screened. Sometimes it is due to fear or embarrassment. Feeling anxious about the exam is understandable. Lack of time can also be a big problem. Cost or lack of insurance is another concern. Some women may not know they need screening. Cultural beliefs can also play a role. "I kept putting it off, I was just too busy," one woman shared. It is important to overcome these barriers. Healthcare providers are professionals. They understand. They are there to help you, not to judge. The screening test is usually very quick. Think of it as a few minutes for your long-term health. Many clinics offer low-cost or free screening. A patient once told me, "It wasn't nearly as bad as I thought." Knowing you're healthy brings great peace of mind. I encourage you to make a promise to yourself. Promise to prioritize your cervical health. Getting screened is an act of self-care. It is an act of empowerment for your body. Your health is one of your greatest assets. You have the power to protect it. Don't let fear or misinformation stop you. Take this important step for your well-being. You can find clinics and support in many places. Your local health department is a good start. Organizations like Planned Parenthood offer services. The National Breast and Cervical Cancer Early Detection Program helps. Talk to your doctor about your options. Please share this message with other women. Encourage your friends, sisters, mothers, and daughters. Together we can raise awareness and save lives.